We are going to be recording. Hi, welcome everybody on this kind of a gray day. I'm Pam Wycliffe. I am with the Lunch with the League Committee, and welcome to you all today. First, I have a few things to say, as most folks already know. We never support or oppose any political party. The League is nonpartisan political organization, and we encourage informed and active participation in government. We don't support or oppose any political party. We have two separate and distinct rules. Oh boy, this is going to be. One is voter services and action, citizen action, education. We present an unbiased, nonpartisan information about elections, voting process, and issues. The other role we have is action and advocacy. We're nonpartisan, but after we study, we use our positions to advocate for or against particular policies and public interest. The comments or opinions that folks may speak today aren't necessarily those of the League. We'll be here from noon till 1. Our general format is the speaker to speak for a half hour, and then we'll have questions for the last half hour. I'd like everybody to please remain muted during the talk. And if you have questions or comments, please put them in the chat down at the bottom, and we'll read them. Kent will either read them or I will read them so they can be answered in order. And if you have any interest, which I hope you do, in the League of Women Voters, please, you can find the information at the League of Women Voters South Bend, lwvsouthbend.org. We have a few bits of news to say. Our local league is working to establish an observer corps. Volunteers who serve as the eyes and ears of the League by attending public meetings, preparing brief reports about the meeting. If you want more information, please refer to our member newsletter, which is the LWV News Updates, or send a note to Jerry Pawlowski, GERIPAWELSKI @gmail.com. Also, Amanda Parkinson, who is the Director of Administration, sends out our weekly or our bi-weekly League of Women Voter newsletters on the first and third Monday each month. If you'd like to receive these informative emails, please add her email address and let her know so she can send you those updates. And it's Amanda Parkinson, PARKINSONLWV @gmail.com. Okay, our speaker today is Dr. Kent Laudeman. He's the director of United Health Services Suicide Prevention Center. Dr. Laudeman said he avoided the draft, like many folks probably did, or tried to at least back in the day, by staying in college for 7 years. But then he was drafted, and he's a veteran of the Viet Nam War, the Persian Gulf War, and Operation Joint Endeavor in support of peacekeeping in Serbia, Kosovo, in the Balkans. He retired from the military as a U.S. Army Lieutenant Colonel after 28 years career. He's a Western Michigan graduate with a doctorate in education, and he has taught and has been in administration at West Point, IUSB, and the Veterans Advocate and Advisor, Michiana Area, and was director of Robert L. Miller Senior Veterans Center prior to being director of the United Health Services. And these are just a few of his credentials. His most prominent quote is, "Not one more life." And I think I will, when we do, oh, I'm not going to add that. So I'll let you take it over, Dr. Laudeman.
Well, I'm not sure what you were going to share, but
Well, What I was going to share was when we go to naturalization, when they used to have naturalizations
Yes.
At the federal building, often it was the Miller. They would bring the flags in.
Oh, the color guard.
From the Miller color
Yeah,
guard.
Ed Burris runs that group.
And they would, isn't this from the same thing that you were the head of?
Yeah. I know Ed well. He's a Marine, a Viet Nam veteran, etc. So anyways, I've had an excellent opportunity. I'm not sure how many of them I really chose when I was at IUSB, and certainly going from there to United States Military Academy. I hadn't heard of the academy when I was a young person, but was there for 13 years. I then retired, but flunked retirement and started the Miller Veterans Homeless Center for homeless veterans here in this particular area.
Yeah.
And then I kind of retired from there, So I flunked retirement again, and then found out that I needed to do something, and was fortunate enough to find this part-time position as director of the Suicide Prevention Center. Now that sounds impressive, but it's an office of one. So I supervise myself, and I can complain to supervisor at the same time and move on from there. So I kind of like what I'm doing in that respect, okay? Now, today, I'd like to talk about some challenges, some thoughts, general information. I only have two goals. One is for you to be a link and for you to save a life. We'll talk a little bit about reducing stigma as far as mental health and suicide is concerned, some correct terminology, and I'm going to run by you 4 myths. Then I'm going to give you some statistics, get into some warning signs in terms of what to look for. And then I'm going to share with you some programs that are available that we do here in terms of working on mental health and suicide prevention. So the program only has 2 goals. Hopefully, and this is the same thing I say as far as students are concerned, either in junior high school, or college. Hopefully after this, you'll feel more comfortable in being able to ask for help for yourself. And by all means, in being a link for maybe that's somebody that's contemplating suicide. And generally there's an underlying mental health issue there, depression, but it's concomitant. It doesn't mean that depression causes suicide, but many times we see both coming up at the same time. So I hope you had your coffee through the day to keep the grumpy away, and take time and realize that you may not have a good day, but there's something good that happens in every day. And it's something that I cherish. And since this is getting close to Martin Luther King Day, I like the quote of his. I think it's very applicable in terms of mental health and the struggle we see as far as suicide is concerned. If you can't fly, then run. If you can't run, then walk. And if you can't run, then crawl. But whatever you do, you have to keep moving forward. And I think that speaks a lot as far as those who have experienced suicide, perhaps either in attempting or being a survivor. Another good quote that I have and I like, it's a Native American proverb, and it goes like this: tell me the fact and I will learn, so you will get some facts. Tell me the truth and I will believe. I hopefully share with you some truths. But tell me a story and I will live. It will live in my heart forever. So I'm going to share some stories as we go through this. And this is the kind of thing that, as I spin into too many stories, this gets a little bit longer. So I'm going to ask Pam to kind of control my storytelling, and we can get to the end of this. There's 2 resources that are available to people. That's certainly our webpage, and you see that at the top, uhs-indiana.org/programs/suicide prevention. So you will see a little bit about what I talk about today and some of the services that are available. And I also do a Facebook, and you see that there. And I try to throw up 1 or 2 important things each week on the Facebook. But the Facebook begins with this particular quote: The person who completes suicide dies once. Those left behind die 1,000 deaths, trying to relive those terrible moments and understand why. So the biggest question we have in this kind of death is why. If somebody is injured and dies by accident, we know the why. If somebody dies from a disease, we know the why. But if somebody dies by suicide, that answer goes with the person that has died. So in helping to reduce the stigma and raise awareness, we don't say committed or successful suicide. We say died by suicide, okay? If you put committed in there, you now bring legal kind of issues and religious kind of issues along with it. And I hold the opening as far as saying things in a political kind of way. Well, this is kind of like the same thing. And sometimes it's hard for survivors to say died by suicide, but that's a hurdle that they've got to get over. Failed attempt is just attempted suicide. And at the bottom there, you see suicide attempt survivor and survivor of a suicide loss. This is the new high-risk group. And as you see some statistics I'm going to share with you, that group becomes larger and larger with each suicide death that we see. I'm going to share with you 4 true and false statements or myths in terms of mental health and suicide. And the first one is true or false: alcohol or drugs have an impact upon suicide. These are the same myths that I share with youth in a yellow ribbon program. And I ask them to mentally answer that question, or I'll have them take out a piece of paper and say, hey, write down true or false for the first item here. The answer is 50% are youth who have died, and 70% who have attempted were under the influence of alcohol and drugs. And that makes some sense because we know that they're dealing with a mental kind of pain, not a physical pain, a mental pain. And we know that as a veteran, I sometimes can go into a long story and talk about the fog of war. I mean, what you do as far as a veteran is concerned is you do squad tactics and training, you do platoon tactics and training, you do company tactics and training, you do training till it's coming out of your ears. But when you have yourself in a combat situation, there is the fog of war, and Murphy will show up. And I apologize for anybody that's named Murphy, but if something will go wrong, it's going to go wrong in the fog of war. Well, the same thing is happening with the youth and a young person that's under the influence of alcohol and drugs. It's much easier because the frontal cortex isn't working at that time for them to think about taking their life. So the first answer is true. True or false? Suicide people always want to die. Hey, suicide people really want to stop the pain that they're feeling. I'm going to share another story. I got to stop sharing stories here. We'll never get to the end. I had a battle buddy that was at Walter Reed Army Medical Center in Washington, D.C. And a couple of years ago, I visited him and asked how things were going. Now, a little bit of history here. He was in Iraq driving in an armored Humvee. He was in the shotgun position along with the driver, the only two in the vehicle. They hit an IED. An IED is an explosive device. The Humvee went upside down, crashed. The driver died. He survived. But in his survival, he lost his legs from the knee on down. So he was at Walter Reed for physical rehab and also mental rehab because now he had PTSD and probably TBI. And we were talking in a casual kind of way, and all of a sudden he stops and he says, Kent, you know, I understand the diagnosis and prognosis as far as my legs are concerned. I have prosthesis. I'm getting used to using them. I know that I'm going to get back to something that I was before the loss. So that's very positive. But I also have PTSD. I understand the diagnosis. I kind of understand the prognosis in terms of what I need to do. But the pain is always there in terms of understanding and working my way through it. And part of that pain is, why did the driver die? My driver died and I did not die. Okay, so there's some shame and some guilt that's coming there. Now, more important, if you're in a wreck or a hostile kind of situation, the assistant driver has the job to be watching for IEDs. It could be a discarded vehicle. It could be a dead animal. It could be trash. It could be a brown bag. It could be a bump in the road. And he didn't see it. He did not see it. So he's suffering with the shame and the guilt of why he's alive and why he might have been the cause as far as the death is concerned, because he didn't see something coming. So it's an emotional and mental pain that we're talking about, not so much the physical pain, because given good medical advice and support, we can probably get through the medical issues. But it's the mental and emotional pain that we're wrestling with. All right, third item, true or false. So we talk about it will cause it to happen. Hey, very briefly, if we talk about a health issue, such as a heart condition, are we going to cause it? If we talk about cancer, are we going to cause it? If we talk about diabetes, are we going to cause it? No, the answer is no. If we talk about it, we're not going to cause it. So in terms of reducing the stigma, we need to talk about mental health and suicide so that we can intervene and help somebody out. Last one, true or false, only professionals can do suicide prevention. Well, the answer is false. Obviously, many of you have been trained in first aid and CPR, and under the Good Samaritan law, no, you can save a life with first aid and CPR. So the same thing is applicable as far as suicide prevention is concerned. Anybody can do it, and I hope that you'll feel more comfortable in maybe saving a life by the end of this presentation. All right, some statistics. I'll bore you with these. Nationally, 2018, and you see in red 2019. 2020 is not out, but we think the preliminary deaths by suicide in the United States is going to be 45,855, probably confirmed within the next month or so. In 2018, we had 48,000. 2019, hey, there's some good news there, 47,000, and even some better news if it holds for 2020, 45,000. That's about a 2 or 3% decrease each one of those years. We don't have any idea yet as what's happening as far as 2021. But even looking at that data for 2018 and 2019, there's 132 individuals in the US, or 131, depending on the year, that die by suicide each day. That means one person every 10, 11 minutes. So since we've started here, we've lost one person to suicide already. In a day, we'll lose 12 young people to suicide. We'll lose 20 to 22 active duty and veterans to suicide today. Suicide is the most preventable death that we can work on. It's the 10th leading cause of death. That moved to 11th with COVID for everybody of all ages, okay? And in the state of Indiana and in the nation, it's the second leading cause of youth, defined as between 13 and 25. Well, let's go from the nation down to something that's closer to us. Indiana, 2018, 2019, and St. Joe County. Indiana has been right in the middle of the pack in terms of number of suicides per 100,000 population. That's the only way that you can compare, not on number of deaths in a particular state, but what's the number of deaths per 100,000? So we were right in the middle, 26, 25 in those 2 years. And if that number holds, and I don't have the number yet for the state, we think we're going to be in 36th position as far as state for suicides with the 2020 data. And we saw that in 2018, in the Indiana, 1,079, 2019, 977, and I hope 2020 is even lower than that. And that would give us our 36th position, okay? Let's drill down to suicides in St. Joe County. 45 in 2018, 42 in 2019. Ooh, what happened? 51, and this is right from the coroner's office for 2020. So it is going up. We see it going up as local data. Overdoses in St. Joe County, 62, 37, and look what happened, 83 in 2020. Many times, sometimes an overdose can be a suicide. But on the death certificate, it'll be indicated, unless they've done a psychological autopsy or a history background, it'll indicate an accident by death. Now, if a young person dies by suicide, we know it's going to affect at least 6 people. And that's going to be 1 to 2 parents, perhaps a brother or a sister, grandparents, close friends. And then it starts to get bigger. Teachers, if they're in school, boyfriend or girlfriend, if they're working with somebody at work, a coworker is going to be impacted. In fact, if that student is taking 6 classes and there's 30 students in each, the number of people impacted could be as high as 236. So it's just not the one person that's died by suicide. Well, let's look at some warning signs. And if a person is saying directly, I'm going to kill myself, nobody needs me, I wish I were dead, I don't want to live, that's definitely a red flag. And we've got to act on that particular red flag. Sometimes they'll soften it up a little bit and there'll be an indirect statement such as, I shouldn't have been born. You won't have me around much longer. My family, my job, my friends would be better off without me. If such and such doesn't happen, I'll kill myself. There's generally a relationship kind of problem that's coming with those. So those are definite early warning signs that we need to listen to and be able to get some help for that particular person, okay? Now, whoops. Here are some other warning signs. Generally somebody that's contemplating suicide. And if we look at suicide, it's generally gonna occur in a peak. And it's probably 1 or 2 hours when they're at that peak. Now it could be a week or a couple of weeks as they get into planning and actually executing that particular death by suicide. And another warning sign that's not up here is if there's been a previous attempt. That, along with what they're saying in a direct kind of way and indirect kind of way, is definitely a warning sign that we need to keep in mind as we're listening and hopefully wanting to save a life. So withdrawing family and friends, I had a gal come in here that withdrew not only from peers at school, but from her family. She withdrew to her bedroom, and that wasn't good enough. She withdrew their closet. So withdrawing from normal things that they're doing is a sign that they're maybe thinking about that of taking their life. Reckless engaging in risky behavior could be promiscuous behavior, could be shoplifting, could be speeding if they have a car, things of that nature. Giving away a prized special possession. If I have a young person that wants to give away their leather jacket that they value, or a piece of jewelry, or maybe their favorite video game, something that's really precious to them and they don't normally want to give this up, that could be a warning sign. Now I'm going to show you now a challenge coin. I hope you can see it. That's one side, and it has my rank on it and years that you can't read. And on the back, it says United States Army Soldier for Life. Well, after 28 years, I earned that. That's very precious to me. So if I were to give that to a battle buddy, Ed Burris, who runs the Miller's Vet Color Guard, he should be asking me, Kent, why are you giving that up? You know, you carry that around in your pocket. And I even worry about losing it. So that is a precious item to me. So if somebody is going to give up a precious item and they're talking about giving it to you, hey, that's another warning sign. Increased alcohol and drug use. We talked a little bit about that. Anxiety and unable to sleep, sleeping too much, not sleeping. Sleeping could be withdrawing too. Dramatic mood changes. Generally somebody that's been happy and outgoing and all of a sudden becomes sullen, withdrawn, and sad. Now we're saying dramatic, okay? Or it could be a person, very withdrawn, sad, all of a sudden becomes outgoing and wanting to talk and sharing. Somebody that was religious becomes non-religious. Somebody that's non-religious that all of a sudden becomes very religious. That's a dramatic kind of change that we're talking about. Many times we're going to see uncontrolled anger. Girls get sad, boys get mad. I don't know where that saying comes from, but It's an outburst. They're saying something is wrong. So anything that's a significant change as far as attitude and behavior is a warning sign. Now, is there one warning sign that trips that person over? Certainly anything said in a direct and indirect kind of way, going online and looking for ways to die. Those are definite warning signs. And I had a survivor share with me, and I am a survivor. I lost a veteran in Viet Nam. I lost a student who was at West Point, and recently a veteran by the name of Jason Rhodes in 2018 died by suicide. He was the commandant at the Marine Corps League on Edison. So this survivor, as she tried to understand her feelings and the why, as far as her son is concerned, says, vision a cup of water that's full to the brim and almost ready to overflow. And sometimes there is a catalytic kind of event that occurs. That could be a divorce, that could be a separation, that could be a loss of an immediate family member, that could be a loss of job. I mean, there's a lot of things that can come in there that might be that tipping point. But what she says is that everything that's below that water that's going to overflow is also contributing to this. So there could be one thing that happens that's kind of the straw that breaks the camel's back. Well, there are stories out there, and certainly American Foundation for Prevention of Suicide, AFSP, if you Google that and go in there, you'll find all kinds of stories. Same thing with American Association of Suicidology. And there's two other stories here that I'm going to share quickly with you. I don't know if you've ever heard of Kevin Hines, but Kevin Hines was at the Century Center, I think about 2017, 2018. And he was talking to an audience of about 800 up in the ballroom and on the top floor, main floor there. And he was telling his story. I don't know if any of you are aware of his story, but you can Google and listen to his story. So his story is this. He came from a family where the parents were abusing, misusing substances, alcohol primarily. He went from that family to another family, and they were good parents. He had wrestled with depression and being diagnosed as a bipolar depression for many years. And he was kind of in and out of help in that respect. As a high school student, he wasn't your A student. He wasn't a super athlete. He played football and was a better wrestler. He graduated from high school and was attending junior college. One day, in his mind, something was telling him about suicide and dying by suicide. He was on the back of the bus. He was heading for the Golden Gate Bridge. The Golden Gate Bridge is really known for suicide. Almost 2,000 people have attempted and only 1% survive. Kevin, two-way traffic going both ways, sidewalk on both sides. An engineering marvel, blue water in the background, San Francisco Bay, sun was out. And he was walking along the sidewalk, hand on the railing, contemplating suicide. A young lady came up to him and said, "Would you take my picture?" Her in the foreground, structure of the bridge in the background, blue water in the background. He said yes, and he took a picture, and then she walked on. He went over the rail and stood on the outer, there's a place that you can stand on the other side of the rail. His hand was on the rail. He jumped. Immediately, as soon as his hand left the railing, he knew he had made a mistake. So that's the ambiguity that we need to keep in mind. Somebody really doesn't want to die. They're wrestling with that mental and emotional pain that they're feeling. Well, now he's falling 250 feet, 25 stories, 75 to 90 miles an hour. And 3 to 4 seconds, he's going to hit the water. And if he was flat on his back or his stomach hitting the water, it's going to be like hitting cement. But he managed to right himself somehow and go in feet first. So he broke his fall, went in feet first, fractured vertebrae in his back, fractured his ankle. And now his greatest concern was he's going to die. He's going to die by drowning. He's so deep in the water. But he talks about a big fish pushing him to the surface. And it just so happens to be that there was a boat and a captain of that boat. And the good captain came over, found him there because one of his duties was about 2 people per week attempt suicide off the Golden Gate Bridge. It's the most known bridge for suicide other than one in China. So that was his duty. And he was with the Coast Guard, one of our fellow sister brother services. And the good captain came over as he was on the surface of the water and fished him out. And he said, you know, out of 56 people that I've collected out of the water, you're the first one to be alive. Well, Kevin was very thankful. So Kevin started his own nonprofit. And his nonprofit is to raise enough money to put a chain link fence along both walkways on the Golden Gate Bridge, actually millions of dollars. He thinks he's going to get done in 2022. Because we know if you can secure the means of suicide, you can stop a death. If you can secure the means of suicide, be that a firearm, be that pills, be that whatever it is, if you can secure it, you can stop a death. And we know that that peak is a short period of time. But understand that that person is thinking about suicide is only wrestling with the pain, the mental and emotional pain that they feel, and dying by suicide and relieving themselves of that pain. That's the only 2 answers that they see. There's no other solution to what they're wrestling with, okay? Whatever's causing that water in the cup to bubble up and why they're thinking at this particular time, and a drop is going to go over the side, okay? So Kevin, when asked, said, you know, if somebody would have just listened to me, I probably would have changed my mind because ambiguity was there. Well, the next story, TED Talks, and you can go to TED Talks, bring up Sergeant Briggs, Golden Gate Bridge again. Another Kevin. In about 50 minutes, he listens to Kevin, another Kevin that's on the other side of the walkway, ready to jump. Sergeant Briggs, 20 years, California State Police, one of his jobs was kind of patrolling the bridge. A lot of the things he learned was on the job training, what he was doing. He listened to this Kevin for 90 minutes. And generally somebody that's thinking about suicide wants to talk. They do. So he listened for 90 minutes. Kevin came on the other side and he got some help for Kevin. So one of the key things is a short time period as far as the actual act of dying by suicide. And we want to listen. Now, I'm guessing that most of you have a smartphone of some sort, okay, an iPhone of some sort. And what I want to share with you now, you've got the warning signs, you've got the data, we've dispelled some myths, we know we're going to call it a death by suicide, etc. So I want to give you some tools. And these are all free tools that you can download at no cost to your iPhone. And one of those is the Yellow Ribbon program. And there is a card for that. And I think Pam sent you maybe a copy of that card. And on the front, it has the issue as far as this ribbon is a lifeline. It speaks briefly about that. But on the back, there are 3 steps there to be a link.
Excuse me. It's not progressing on your PowerPoint.
Ooh.
We're still at warning signs, the first warning signs.
Wow, I've got it. What happens here? Let me
We're
see if I
stuck
can
on
break-
number 11.
Yeah, let me break out of it and come back into it.
I'm sorry.
What happened to my share here? Share, come on. Explore classes. Do you see anything different right now?
No, you still have control of the page, but you're on that number, page 11.
Yeah, and it's not advancing either on my. Okay, let's do this. Now can you see the whole thing?
No,
I can see it, you can't see it. So what's happening here? Stop share, and I'm going to come back in.
hi, everybody.
Hello, hello, share. New
There you
slide?
go.
Okay, I think we're back on track. Okay. So the backside of this card has the 3 steps to be a link and to save a life. And the first part of that is to stay with the person. If they're showing you any of those warning signs or a combination of those warning signs, be patient and stay with the person. Listen, really listen to that person. That's what Sergeant Briggs was doing. He listened for 90 minutes, okay, because they generally want to talk. They're wrestling with emotional and mental pain, and then get them some help. Now, on that card, you see the crisis line 1-800-273-TALK, or the number is 8255, or you can text 741-741 help. Now, let's make this simple. If you remember 1-800 and put suicide in, you'll have the crisis line. And I know you can remember 1-800. And I know from this talk you remember suicide. And I love those people. That's a service that's available 24/7. And there's 175 different locations that answer from the area code that you call from. So if you call from this area code, you're going to get somebody that's familiar with resources in this area code. They can tell you the address for Memorial, for St. Joe, for Elkhart Hospital, etc. They're a great resource. In fact, I've many times, as I've listened to somebody that's contemplating suicide, say, do you mind if we use the text line or the crisis line? Now, I generally try to do it on their phone, not my phone, because I know they got the text line and then the crisis line on their phone. And that becomes a third person that's listening. So now we brought kind of a professional person in to help you feel more comfortable in working with this person that's thinking about suicide. So there are great resources there, okay? Wow, now I'm not advancing here. What's going on? Let me see if I can do something else. Now, do you see a new slide?
Yes.
Yeah.
All right. If you download this app and go to the store for either an iPhone or an Apple phone, just put Yellow Ribbon Program Suicide Prevention in it, and you can download this. So on that, you're going to see the crisis line, you're going to see the text line, how to ask for help, the warning signs that I talked about, something especially for teens. I don't know why this is not advancing. Let me try something else here. Now do you see a new slide? Okay. So this is something else that you find in that free app for your phone. Covers many of the things I talked about as far as this presentation already, okay? And you've got it right on your phone. In fact, there's two PDFs that you can download. One is to how to talk to your teen as a parent and how to respond to a cry for help. And there's also one as far as a staff member at a school is concerned, okay? Another resource that's out there is by the Jason Foundation and A Friend Asked. So if you go to your store again, Android or Apple, put A Friend Asked, the Jason Foundation should come up. And as you open that, you download it, you save it, you open it, you see what's on the right-hand side there. Get help now, the crisis line, the text line, etc. There's also an organization there called SAMHSA. See that? SAMHSA. That's the Substance Abuse and Mental Health Service Association. Had to think about what it was. But if you go into that, you can actually put in your zip code and come up with help that's available through various organizations in that particular area. So if you put in the zip code for us, Oakland's going to come up, Four Seasons is going to come up, etc., as far as getting help. So I just wanted to highlight that with that. Now, there's another one that you can download called My3. Go into your store again and just put in MY3. And I have this on my phone. And this is actually something that you're doing for yourself. If you feel like you're stressed out with COVID or whatever it might be, who are 3 people that you could talk to that you see over there on the left-hand side? And you can load them so that you have them at your fingertips. You could even put in, what are your warning signs? Well, if something happened to your son or your daughter, that might be a warning sign. If something happens to your spouse, that's going to be a warning sign. You could put in your coping strategy. I mean, you could drill down and do a lot of things with this, okay? Now I'm going to rush here because we're getting close.
Yeah, because some folks might be leaving, like I said, they might have to leave a little early because of that, and people might have questions. There are a couple.
Okay. So one other resource here is available to us. You see at the top there, HTTPS, My Strength. And if you put that in, it does require a user ID and a password, but there's a ton of resources there that you can do 24/7. And this is a look at my phone in terms of what I've downloaded with all the free resources that are available in this particular area, okay? The last thing I want to cover is that we're doing a local outreach to suicide survivors. We know that there's been 51 people that died by suicide in St. Joe County in 2020. Coroner's office, because of the Privacy Act, can't give me that information. So I have to watch for them. And under the loss team, we're putting together a hard copy bag of 5 items, or digitally 5 items that the coroner could share, or funeral home could share, or law enforcement could share as far as resources in this particular community. So that's a way that we're trying to reach out and get to people, okay? Certainly that survivor group that we need to get in contact with. So what can I conclude with? Suicide prevention is everybody's business. Everybody can be a link, okay? Many thanks for your time. I enjoyed doing this. We had a few technical problems, but I think we did pretty good. So comments and questions. Let me see what I can pull up here. I think I've got to stop the share, get into chat, and it looks like there's maybe isn't there really a short text number for actual kids contemplating? I am only aware of the 741-741, which is used by teens. So I'm not sure what you mean as far as kids are concerned. Youth and certainly teens like to text and will not use the crisis line.
Right.
So the 741-741 works like the crisis line. I'm older. I like the telephone better than I do the text line. But that 741-741 will work, okay? So I don't know of another number. And that 1-800-suicide number is going to change to 988 in 2022. So all you have to do is dial 988. It's like 911 and it'll work. All right. What's the next one here?
I think it was Elizabeth Benyon's. Oh, you mentioned that you were a survivor of suicide when somebody else dies of suicide. How are you a survivor?
You could be a survivor of immediate family, brother, sister, parent, father, mother, grandparent. You're a survivor. It could be a friend, in my case, a battle buddy. Okay, not somebody in the immediate family,
but you're called a survivor.
And I knew, excuse me?
But you're called a survivor.
Yeah.
Oh,
yep.
Okay.
I'm still dealing with the why. I don't know why that student that I had at West Point died.
Okay.
And that's the thing that bothers me. And the thing is, like the mental and emotional pain, the shotgun Why did that person die and I didn't die?
Yeah.
And the shame and the guilt goes along with, I should have done more. Certainly feels strong by a parent. They always feel that they should have been doing more. Even after they know the warning signs, they won't see the warning signs because you're kind of standing in the forest, okay?
Yeah.
So anybody can be a survivor. I've had a survivor in my support group that showed up 20 years later.
Yeah.
Still wrestling with it, okay?
Here's a question from Elizabeth. You drew a distinction between physical and mental pain. Can't they be connected with mental pain manifesting as physical pain and prolonged physical pain leading to a mental distress or anguish? And can prolonged chronic physical pain increase suicidal thoughts?
So as I get older, I have more pain. We all do, right? And part of that pain is, I'm a runner. I can't run a 5K like I used to when I was in the 40s. And that is frustrating to me. So mentally, I've got to accept. I've got to accept that, my body's going to go through changes. Okay. Now, if you can't accept that, and this can happen with cancer or something like that. I mean, the frustration that comes on. Remember Dr. Kevorkian out of Michigan? Really suicide-assisted death is what it was, because the person was feeling so much physical pain, and they were probably receiving all kinds of morphine, and they were so frustrated they wanted to die. So yes, there can be a connection between the mental, the emotional, and the physical.
Okay.
But the reason I shared that story was this happened to be something physically that the battle buddy could work on and get mostly back as far as his life is concerned. And he was struggling with the mental part because he understood it. But damn it, the flashbacks and the nightmares keep showing up.
Okay.
And he can't block them out. Okay. Good question. Good question. And I hope that's an answer. What's the next one?
You mentioned that taking control of the means of death can stop a suicide. Haven't studies shown that keeping a gun in the home is correlated with higher suicidal rates for teens, and that securing the weapon, putting it in a lock safe and with a secret password and stuff, can reduce this rate? What is your advice for gun owners?
So
we do have quite a few questions. So
yep,
we
veterans
need to
are gun
keep the
owners.
answers short,
And the primary means as far as suicide with youth or adults is firearms, 51%. Okay. After that, it could be ingestion of sleeping pills. After that, it's asphyxiation. That's about the three that happen there. So yes, if you can secure that firearm, and I say this to police officers, okay, and the suicide rates are higher in those who are familiar with firearms because they're available. You've got to not put that firearm on the nightstand at night. You've got to secure that. And don't put it in a secret place because the teenager is going to find it. And if you've attempted suicide, if I have firearms, I hate to say that, I do have firearms. I'm a veteran, okay? I don't want to give them up. What Ed would say to me is, would you trust me to keep your firearms during a period of time? That's securing a firearm.
Okay.
So it could be locked up, could be secured place. I'll say, would you, if a veteran is contemplating suicide and has the means with him, at some point I'm going to say, would you trust me to hang on to your weapon? Okay. Would you trust me to lock it up for you till we get you some help?
Okay.
So if you can do that, same thing with pills. In the jail, this is a long answer. They take away the belt and anything that can use by hanging, okay? But the primary means of suicide and death by suicide in a jail is hanging. And in the St. Joe County Jail, they were watching somebody under suicide watch. And he was really kind of a sloppy person. He didn't make his bed and everything like that. But all of a sudden, change of behavior, he made his bed. It was unusual for him. And they checked back and he wasn't there and he's hung himself with the sheets. So unusual behavior, a certain change of behavior, if you can remove the means, Hey, they took away the shoelaces, the belt, and everything else, okay? But that person so determined still found a way to die by suicide. Next
Okay.
question.
What can we do to help a relative who frequently talks about having suicidal thoughts, but always mentions this after the thoughts have passed?
You can always call the crisis line. I have called the crisis. I generally call the crisis line about every other month. One, to know how quickly they answer. And I don't go to the VA section, because if you go from crisis line, press 1 to get into the veteran section, you now go into the VA organization. And there's only three sites that are answering for that. And quite frankly, veterans don't want to share with the VA that they've thought about suicide. So stay with those 175 sites. They're good. They've got a week's training and they got a supervisor over the top of them. They're good at listening for warning signs. They have access to resources. Okay. They can say, yeah, Bill, Jim, I think the best answer is we need to have Jim take Bill to the emergency room. Okay. You maybe can't make that answer. Okay. And if you're thinking about suicide, give them a call. If you know something's thinking about suicide, give them a call. They'll give you some rest as far as your anxiety is concerned. And the important thing is they're available 24/7. 24/7. Very experienced people. You can go to the emergency room. I've taken people to the emergency room. Hey, I've seen enough warning signs. You're thinking about suicide. I've secured your weapon, but I'm not going to turn you over to somebody unless I trust them, a family member. I think we need to go to the emergency room. I've taken multiple people to the emergency room, and they will go through, after admission, a screening process to determine how strong that death by suicide is, and then work from there. They can only hold them for 24 hours. So I say to police officers, hey, if you see the person on the street, they became rational and said, no, I wasn't thinking about it. And that hospital can't hold that person beyond 24 hours and they could be back on the street. Next question.
I'm not seeing. Does anybody else have a question? I'm not seeing very many faces, and I don't see any more questions.
Nice to see you.
Oh, wait, Kathy.
Question.
Why do
Kathy.
you think several of the Capitol Police committed suicide after the insurrection January 6th? Was it PTSD?
Could have been, because we know that PTSD and suicide are kind of comorbid. But not everybody that has suicide or has PSD or TBI is going to die by suicide, just like depression, but we see them elevated together. So they're certainly playing a role as far as that cup of water and whatever's underneath that bubble that's ready to flow over. I think frustration with the job, their own values, what happened to them. We're talking about mental and emotional pain. We're not talking about physical pain. Now, some of them were assaulted, okay? But put yourself in their place. Something that you believed in protecting a life, and all of a sudden you didn't protect a life. My biggest worry in the armed services is the medics who are treating their fellow veterans. And it's not just a medical situation anymore. If they lose a life, they've lost a battle buddy in a squad or in a unit that they're in. And they're going to feel more responsible, just like my assistant driver and the driver story. Okay. So the medics and the corpsmen, I really worry about in terms of what they're exposed to. They can do their job in the field. They're medics, they're strong, they can do that. But when it becomes a person, think about almost a family person, that really makes it tough. Good question.
Dr. Laudeman.
I think we're going to see, one of those slides says we've got twice the number of suicides than we do have in line of duty for police, 2 times suicides versus line of duty. I think suicides are going to be up for 21 and line of duty is going to be both up. Okay. I worry about that particular group right now. Okay.
We have a copy of Dr. Laudeman's PowerPoints, And I will have Amanda Parkinson send it out to everybody so that everybody has that, as well as the recording that we have of today's session. And if there are no more questions, I want to thank you very much, Dr. Laudeman, for all that you said to us. And this is the time of year too that we need to worry a whole lot with COVID, but also just the season.
So we could all do those 3 steps. Stay with the person that you fear is thinking about suicide, listen to that person, okay, and then get help. And that help could be easily the emergency room, okay? Whatever you do, though, if you fear that and you call the crisis line, the 2 of you can work that out with the person too. I would take that person, or strongly suggest that that person make a mental health appointment very soon. And if I feel strong enough that they're not thinking about suicide anymore, I'm going to give them a call and say, hey, did you follow through with that appointment? Okay, because I'm concerned about you.
Yeah.
Okay. If somebody you think is thinking about suicide and you don't ask them the question, are you thinking about suicide? You've lost your integrity, because they want you to listen and you didn't listen. All right. I can't do any more than a half hour or so here, but I really appreciate talking to groups and trying to get rid of the stigma as far as suicide is concerned. Thank you very much.
Thank you very much. And thank you all. Remember, next month, the second Friday, we'll come back. Bye.